Hello, everyone. I'm Arya, your host for today's session, and welcome to the FB Live, where we learn about primary care for cancer prevention. Well, if you are Indian origin living in US and your parents are visiting from India, you do not need to worry about the medical needs in US. eGlobalDoctors has your back. They have different packages for you that provides access to 290 plus board certified doctors from USA and India with 30 plus specialties. Prescription will be provided and they get back to you with 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world. Video physician consultation is about 30 minutes and no restriction on pre existing medical conditions. In app messaging with doctor after consultation and ID and health passport is available. In today's FP Live session, we will be exploring and providing more information about what care we should be taking to avoid the risk of cancer and how we can prevent that. We have with us today Dr. Sarva Lakshmi Kurela. She is a primary care physician, board certified in internal medicine, and she is currently practicing in Worcester, affiliated with the University of Massachusetts Medical Center in central Massachusetts. She's originally from Andhra Pradesh, India, and went to medical school in Andhra Medical College, Vishakhapatnam. She lives in Shrewsbury, Massachusetts with her husband, a daughter, a son, and her beautiful dog. Welcome to the live. How are you today?
Doing good, thank you. How are you?
I'm good as well. It's great to have you today on the live. This is a big topic, like how can we prevent cancer? Uh, I think I'm going to start with a basic question, like what are the main causes of cancer and how does a person know that he or she is at risk?
I know it's a good question. It's strange because cancer is so sneaky, I should say, and sometimes it's unpredictable. And the risk factors that we can really look at are maybe sedentary lifestyle, lack of nutrition, maybe lack of antioxidants, lack of exercise, obesity. And these are some of the risk factors for cancer risk. And of course, genetics. So lifestyle, genetics, environment, these are the risk factors. Yeah.
Oh, so out of all these risk factors that you listed, are any of these like controllable? We can control and prevent cancer from happening?
Yeah, so exercise is number one. 150 minutes a week is recommended. And, maintaining an optimum weight, BMI of less than 30, 25 to 30 usually is overweight. So 25 or less is what is required to maintain a healthy body weight. And for Asians, it's even lesser, 23 BMI, they say. So all of this is important because to reduce something called oxidative stress that happens in general normally in our body as we metabolize, like say, protein or fat or other nutrients. And so they produce free radicals, which are called superoxide or however you call them. But they're all neutralized by these antioxidants, which is basically the vitamins that we take, vitamin A, D, E, and C. And there is there's enzymatic antioxidants, which are already there in our system that will neutralize these free radicals for us. And for them, we need those micro elements, which are like copper, iron. Iron is not, but those things, those small elements, zinc, those are required to neutralize these free radicals. So this is the oxidative stress that typically puts us at risk for several diseases, not just cancer, diabetes, heart disease, cardiovascular, all of that, and especially the cancer part of it. So that's why it's important to reduce that oxidative stress. And the way we do that is by eating healthy, exercising, and the overall stress, like lifestyle, like for example, we have sleep. Somebody has, Dr. Garimella has done a presentation on sleep, 7 to 8 hours of sleep a day. Or they talk about telomere. All these telomeres are cap for the chromosomes. This can be also affected by our stress. So the other thing that we can reduce also is by living in the present, which the Seva International, they have it as self-program. And that is basically, maintaining a good inner peace sort of a thing with pranayam or yoga. These things really help to reduce the overall stress and then thereby reduce oxidative stress as well. So it's kind of a lifestyle change. But if we start from the beginning, then there's not a change, but that's the lifestyle we lead. So that's where we need to get.
Absolutely. So then, which is the most common type of cancer that you're seeing around among all the possible types? And then how can we prevent that particular one?
Yeah, so in United States, it's basically the lung cancer is the topmost, and in men and women, it is breast cancer. But the lung cancer is also quickly picking up in the women. So the gap between breast cancer and lung cancer is closing for women as well. For men, the second most common is prostate cancer, and the colon cancer comes next. But in India, for example, the stomach cancer comes next also, because the Asians are more predisposed to get stomach cancer. So these are basically the most common ones. And then comes the cervical cancer, the skin cancer, pancreatic cancer, you can't name it, you have it, So cancer is prevalent in other parts of the body, as well as, it's quite, I should say it's not quite common, but it's kind of alarming situation for people, although we have quite a number of treatments nowadays available, thank goodness.
Okay, so you said lung cancer and then prostate cancer for men, and then similarly breast cancer for women.
Yes, that's correct.
Okay. But an estimated of like 1.9 million new cases of cancer were diagnosed in the US in just 2021 that I read about. So what percentage of cancer diagnoses that happened are the result of some preventable causes that it could have been prevented?
Yeah, good question. So most of the 30 to 50% of the cancers are apparently basically preventable. But, there is screening procedures. That's how you basically try to prevent cancer or detect it very much earlier in the stage. So, for example, for the for breast cancer, for example, you basically need to do a breast exam yourself. There's different methods to do a breast exam. And if you want to just go back and see the slide. Yeah, so, it's recommended that you check your breasts once a month or something. And after the periods, or at least 3 to 5 days before periods, is when the best time to check the breasts. You can check them in the shower or wherever. And basically, you can just do smooth movements using the balls of your fingers. And you can either go vertically or you can go circularly and make sure that you don't feel any lumps or anything that's abnormal, or maybe you feel that, oh my goodness, this been not there before, and this is something different. Yeah, that's when you need to seek the doctor's attention. So we don't expect you to feel all the lumps and bumps, but certainly any change in the breast is what is required to be brought into the doctor's attention. That's for the breast cancer. You can do the mammogram for the breast cancers. Mammogram is recommended after 40 years of age, once a year. And if somebody in the family, like the first degree relative, like a mother or a sister, has breast cancer, then you need to go for the mammogram even earlier, like 10 years before the age that the first degree relative has been diagnosed with cancer, with breast cancer. Then there is the MRIs and the ABUS. These are a little more detailed exam of the breast, and these are recommended for people who have dense breasts. Dense breast means that they have more, the glandular tissue in them, and that's pretty much it means, and you have no control on it, and you just need to get your mammogram done and check your breasts often, and that's it. So that's how you prevent the breast cancer. We do have some screening procedures for the lung cancer. Recently, we have 10 years, I think, at least 10 years, we have started doing the low density CAT scans for the lung cancer screening. And this is done for people who smoke at least 25 years of smoking, at least a pack a day. And they need to be at least 55, they said, but we are kind of lenient on the age. We can go a little lower as well, depending on how much they smoked. Unfortunately, smoking is a big thing. Yeah, that's another thing that causes oxidative stress and those things, and it can affect all of your organs. So the lung is the predominant one, and so the lung cancer is once a year thing, cancer screening. We are doing that. So depending on what we find in the lung cancer screening, could it be like a small nodule or a bigger than a small nodule, which requires a biopsy or something? And so early detection is the key for the lung cancer. So that's what we need to aim at doing. If you want to go ahead and see risk factors, are quite a number of them. The antioxidants, we talked about that, and the sleep quality and all that. And then the risk factors are, let me basically display as full screen. I hope I can still see you. Okay. So the lung cancer basically can be smoking, asbestos. Asbestos is another thing that can do that. And the family history. Breast cancer, of course, we went over that. Age 40 is when you start doing that. If somebody has a family member has BRCA gene is another thing that early menopause, early menarche and late menopause predisposes to breast cancer. Radiation therapy for the chest due to some other causes, some of the cancers or something that can do that. The colon cancer is a big thing too. So the general population is at risk after age 45. So we do colonoscopies after that age. So it also depends on family history, the rest of the lack of exercise, obesity, alcohol consumption, tobacco, smoking. So the rest of them, because of smoking, can be throat cancer, esophageal cancer, stomach cancer, kidney cancer is a big thing with smoking. Bladder cancer is another thing with smoking. So all of these cancers can be detected due to early screening procedures. Like the stomach cancer can be detected by upper endoscopy. Somebody had, for example, lack of appetite and is losing weight and has acid reflux symptoms, you definitely want to consider upper endoscopy and take a little biopsy of it and make sure it's not turning into cancer, rather than just say that, oh yeah, it's just a GERD, just an acid reflux, I'll just take Tums. Don't ignore that. Especially if it's going for a little while. Similarly, the pancreatic cancer symptoms are the most important things: the loss of appetite, loss of weight. For pancreatic cancer, it can be jaundice too, and black colored stool. Any change in the color of the stool, like do you have any blood, or is there a black colored stool? All these things matter. They mean that something is going on. So you need to go ahead and do that. Check with your doctor, make sure that you get the proper diagnosis, as soon as you can. Especially the pancreatic cancer is quite aggressive. So you can have pain in your upper abdomen and a loss of appetite, loss of weight, and jaundice. So I wouldn't think that it's just a hepatitis or jaundice or something other things that are unrelated, but that's something that we need to keep in mind. Liver cancer. This is something really preventable. Hepatitis C is treatable if detected early, and hepatitis B has vaccine. So we do need to avail those opportunities to get vaccinated hepatitis B against hepatitis B. Even the liver cancer has the same problems, like, again, jaundice, abdominal pain, loss of weight, loss of appetite. Gallbladder is tricky. It's very tricky. It's very aggressive. We can sometimes, if we are very vigilant and lucky, we can find gallbladder polyps much ahead of time, and we can take care of that. The polyps have different sizes. Depending on the sizes, we can, tell if they fall into that category of turning into cancer. So ultrasound, that's enough to at least say if there is a little polyp or stones. That sometimes the stones themselves don't predispose to cancer, but long run, if they're there for a long period of time, they can cause problems. Yeah, that's similarly the esophageal cancer and the thyroid cancer is another thing I wanted to just mention. That hypothyroidism is quite common, and autoimmune thyroiditis, which is basically the Hashimoto's thyroiditis. This is a common thing that causes hypothyroid problem, and this can predispose to cancer. So it's not very common. I wouldn't worry about if somebody has hypothyroidism, don't think that you have cancer, but but rarely it can predispose to thyroid cancer. And check yourself, like, there's a small lump here, my goodness, okay, let me go ahead and check with the doctor. So those things really help. Being aware of yourself really helps. Yeah, again, there's tobacco. See, look at all the cancers that it causes: esophageal, oral, bladder, throat, kidney, cervical cancer, stomach cancer, name it, pancreatic cancer. So it's hard to quit smoking. And we realize that it takes about 12 times at least to have somebody quit smoking. So keep on trying, and hopefully at one point we will be smoke-free environment.
That was really good information. You explained it all in detail, like each and every type of cancer and how we can diagnose it early and prevent that.
Yeah. So
But you
I was,
mentioned in
Hmm?
yeah.
Go ahead.
You mentioned that you will be need to checking in the family history. So I've heard that some types of cancer are genetic. So this means that the family members with cancer can make you more likely to get it for yourself. So what's the likelihood of that?
Yeah, that's something that's most commonly we see that in breast cancer and colon cancer. And these two are, and melanoma also, the skin cancer. This can be, more predisposed in family members that have these type of cancers. Lung cancer is mostly smoking, but it can be hereditary as well. We'll see that occasionally. So most importantly, it's the breast cancer family history, the first degree relative, the colon cancer. These two are predominantly the pancreatic cancer to some extent. There's something called Lynch syndrome, and then BRCA genes that we check for breast cancer, and for colon cancer, it is called Lynch syndrome. These things can be detected and see how aggressive these cancers can be. And if we detect them a little earlier, it will be helpful.
Right. So are there any particular foods that can help prevent cancer? Like suppose we can have like drinking coffee. Like I'm a coffee lover, so I drink a lot of coffee. But how do I know? Like I have to stop after this cup in today's date. So uh, does that affect like to getting into risk of
Yeah.
cancer?
Anything in moderation, I would say, is fine. Coffee does have some antioxidants, but it also says, some people say that it has acrylamide or something, but I'm a coffee lover too. So I'd go with it. Maybe a cup or two a day is innocent pleasure.
Right. And then how about the sleep or the physical activity at the cancer risk?
Absolutely. Physical activity, nothing like that. We do need to have at least 150 of 50 minutes a week, which is doable. It's not like prohibitively difficult, but it's hard to find the time and the motivation, everything else to do that. So that's something that we need to do. Yeah, antioxidants, we all know that they're in plenty in nuts, fruits, fresh vegetables, spices, another thing, cinnamon, cardamom, all of that. Yeah, so antioxidants, vitamin A, C, D, and E, these things also are good ones. They're there in plenty in vitamin A in carrots, vitamin C, as you know, in all the fruits, a lot of fruits. D is something that we need to work on, because if we are not outdoors, our skin may not be able to manufacture the vitamin D that we need. So we do need a 10-minute a day of sunlight on our skin. That brings to my mind skin cancer. We can't just have our skins exposed to the sun whole day and have sunburns there, and that predisposes to skin cancer, melanoma, basal cell, squamous cell, and all of that, skin cancer. So yes, we do need sunlight. For vitamin D, 10 minutes a day is a good amount without burning your skin, depending on the amount of pigment your skin has. You might need less of it, less of the sunshine. So be aware of that. Apply the sunscreen. That's another environmental the risk factor that is changeable. It's like a 15 plus of the it can be, can basically prevent the ultraviolet rays to damage our skin. So skin protection is important. Cover yourself, or however you do it, skin protection. But again, we need the vitamin D. Vitamin E is there plenty in several different items that we eat. We generally don't advocate to take vitamin E as a supplement, but it's already there in a lot of foods. That's something that is also an antioxidant that can help us.
Okay. So before we get to our last question, I have a question from our Facebook Live. So other than first degree relatives, if any other family member has cancer, do I need to get tested?
It's not that much of a problem. If a cousin or if a grandfather, for example, has them, but the first degree relatives is the father, mother, sisters, and brothers are first degrees. So these are the ones that if they have them, then you need to be checking yourself and being aware of what they have. And it's especially the breast cancer, colon cancer, lung cancer, some pancreatic cancers also that we're noticing that they're much more prevalent in families nowadays. Thyroid cancer as well.
Okay. Hope you got the answer. So it's not a problem if it's not a major issue if that's not the first degree relative, but we need to get ourselves checked once.
Yeah, it's good to know though. It's good to know. Some people say that, oh yeah, my cousin had breast cancer, and 2 of my cousins had breast cancer, not just one. Oh yeah, her mom, who is my aunt, also had breast cancer. Then, of course, you might want to be a little more aware and get yourself checked. So depends on how many of them have it and how, so that type of a thing.
Okay. And so moving to our last question, like changing certain habits in our life can reduce the risk of cancer, as we discussed. So what should be a few changes that you would like to shed some light on that one must bring in their life as a primary care to prevent the cancer?
Few changes? Yeah. Again, I can't emphasize enough on the self program or sleep, exercise, living in the present, and food. Some people call it meditation, exercise, diet, and sleep. And being aware of yourself, just take your time to just be aware of yourself is very important. Reduce your stress levels, and take time for yourself a little bit.
So with that, we'll be wrapping up today's FB Live session. Thank you so much, Dr. Sarva Lakshmi, for walking us through this topic, how to take care of yourself to prevent cancer. And I hope it is of great help to everyone listening and watching us right now. So thank you so much.
You're welcome. Bye-bye.